And now, finally, it is my pleasure to introduce our plenary opening keynote speaker, Professor Pamela Habibović, a leading expert in regenerative medicine and biomaterials. Her research explores how innovative synthetic biomaterials can stimulate the body's own capacity to repair and regenerate. In addition to her distinguished academic career, she currently serves as Rector Magnificus at Maastricht University. Please join me in welcoming Professor Pamela Habibović.
Yes. Good evening, everyone. Dobro večer. It is truly an enormous pleasure to be here today. If I indeed look around and I see so many young people, then I feel even more honored that I am here today with you. And I would first of all like to congratulate the foundation on their 10th anniversary. I've been following you for quite a long time on the socials, on the website. We've been in contact with Eddie many times, also after I became rector. He was probably the one who made sure that everybody, almost everybody in the diaspora, all the Bosnians knew that I became a rector. So thank you for that. I did not have to do any marketing myself. So that happened automatically. I will start in 1 second. I just noticed that I see a wrong presentation because I will give one at the Academy on Monday, and this is the wrong one. I have another one for tonight. So maybe if you could make sure that I get the other one, then we will be fine. Is that still possible? So I did send two. There is one for Monday and there is one for tonight. And if this one could be arranged, then I can. But I can start already while I'm sure they will take care of that. So yeah, what I would like to say. So I was actually asked to say a little bit about my own field, the field of regenerative medicine. And I will also share some of the experiences as an academic and also now as an administrator, because I'm a member of the executive board of Maastricht University, which is one of the youngest universities and the most European universities in the Netherlands and in Europe. Before I go there, I would like to also to mention that being with young people like you are here today is really something that drives me in my own career, and that also helped me throughout my career to be surrounded by people who who recognized something in me, who gave me chances, also when there were doubts, and who offered me opportunities. And I truly hope that with so many of the leaders being present here today, there will be opportunities for you too, because I know Bosnians as the most hardworking nation in the world. I also get many students at our own university who are Bosnians, who sometimes step by to have a chat, who always tell me that they are working very hard because they have to, but that they are always happy to have received the opportunity to be there. And now I've talked long enough and everything has been solved. So this is the right one, regenerative medicine. Let me start by starting with the coffee. And you would almost say, why coffee? There are two reasons for that, because I've been away for over 30 years now, and there is only one place in the world where there is really good coffee, that's here. And this is, as you may notice, that is also Dutch Delft's blue ceramic cup. And that is not the only reason I'm showing this. You will see that actually the ceramic itself, the material that is used to make a coffee, actually plays a very important role in regenerative medicine as well. But let me first introduce the phenomenon of regenerative medicine, which is very, very fascinating. And you may actually know it from this little animal, this newt. And if this is what happens with a newt if you amputate a limb. So if this was an experiment, but this is actually what happens in newts. When you amputate a limb, you can completely remove it. What happens within 148 days is that the limb is completely regrown again. So you can really see it starting very soon. After only a few hours, you see that it is slowly starting to rebuild. And it will, after so many days, it will actually be completely renewed. It will look the same, it will have the same function, it will be completely functional actually. So it is really regrowing the body. Now, I can imagine that, yeah, this is absolutely fascinating, but us humans, we are not so good at regenerating, but that does not mean that we cannot regenerate at all. And you will also recognize that if you are in the kitchen cooking, a small cut will start by bleeding. The bleeding will stop very soon, and then you will, after a few days, you will probably not even see a scar. So that also shows that the humans have the same capacity to regenerate damaged body parts. The same holds for young children. If they play, they fall, they break a leg, all you need to do is basically put it into a cast for a couple of weeks, and then the bone will grow. You will not even see a scar. You will not even see where the damage was. So we can regenerate, but only to a certain extent. So however, that is just to a certain extent, and that means that in many, many cases, this can go completely wrong. So these are a few examples because in my own research, I've been mainly focusing on bone regeneration, the skeleton regeneration. And here are a few examples of clinical challenges. So you see on the left-hand side, you see a spinal fusion. So it is basically the discs between two vertebrae that get damaged. It hurts, it causes a lot of pain. And what we need to do is basically try to fuse the two vertebrae inside the back in order to avoid an emotion and avoid the pain. The second one is a trauma, and I'm really thinking about severe motorcycle accidents, where you really have a very complex damage of a bone. Also then, whatever we do, we can put it into a cast, but such a defect will not heal by itself. And a final example is a tumor. Bone tumors often occur, often like as a metastasis, so secondary tumor after breast cancer or lung cancer. And there, the surgeons will have to make sure that the tumor is completely removed. So they try actually to remove as much bone that contains tumor cells as possible. But then you are left really with a very large defect in a bone. And also that, no matter how long you wait, it will not heal by itself. So really, we have to intervene. And that is actually when regenerative medicine, the therapies that are based on regenerative medicine, start playing a role. Now, what will happen in 9 out of 10 cases if such a patient would come to a surgeon? The surgeon will basically take pieces of bone from elsewhere in the body and transfer that into a defect area. That is often from the hip, sometimes from the chin, so they will remove small pieces of bone and actually put it into a defect area. But this is not without risks. So what happens then is that very often complications occur. There is almost 40% of the patients, they will experience pain for a very long time. You need 2 surgeries, the one to remove bone and the other one to transplant it, right? And most importantly, there is a limited availability. And that is really a problem because if a defect is really too big or you would need transplantation into 2 areas, then there is simply not enough bone. So there is a famous cartoon maker in the Netherlands, Bertrams, and once he heard one of my talks, and then he sent me basically this cartoon and saying, well, you are really a good scientist. That means that whatever you do is you are solving one problem by creating another one. And that, of course, is something that we try not to accept as scientists, and we are actually trying to look for smarter solutions than what surgeons consider the best practice, so the gold standard at this moment. Now, why is this important? I would like just to briefly draw your attention to this graph that actually shows the life expectancy since 1950s or so, 40s until now. And this is in the world as a whole. And as you can see, is that it is really impressive how much the life expectancy has increased. So now, and we are expecting it to increase even further. And it is the entire world, and you can imagine if you are looking only in the developed countries that this is even much higher. So that means that on average in 10, 20 years from now, we will on average live until we are, I don't know, 85, 90. And that is, I assume, is a good thing, but you can imagine that also the chance that you will have some kind of a defect somewhere in the body, whether it is a bone or it is heart or a malfunctioning kidney, you will see that they will stop functioning, and you will need to do something to help the body repair itself. Otherwise, the quality of life of such a patient will decrease tremendously. So this also really shows why regenerative medicine is important, why we need to develop therapies that will help the body heal itself, and that will also help us be functional, because if you are 95, you also want to be mobile, you want to be able to go outside and not only wait until you actually die. So, you know, the increasing the life expectancy is a good thing, but that has to go together with the improvement of the quality of life. Now, before I share a few things about my own research and how we have tried to address, how we have tried to develop regenerative therapies, there is one more slide that I would like to show you, and that is what it is not. So what is not regenerative medicine? Here you see a few examples of probably of the implants or medical devices that many of you will recognize. There is a stent, there is a hip implant, but also a contact lens. And what these materials do, or these implants do, they do a great job, but what they do is basically passively take over the function of the body. So if you have a hip implant that is made of a metal, you put it there, you can walk, but it is not a real hip. The same holds for a stent. It keeps the blood vessel open, but it is not really replacing the blood vessel. So these medical devices, they are a good job, but they are not regenerative therapies. What we are trying to do with regenerative therapies is to actually trigger the body to repair itself, so that you don't have something that is synthetic inside the body, but really something that will only trigger the natural process of healing. Now, that's how can you do that? So what we normally do in my field is to try to think or to look actually into the body itself and try to mimic it. So we are trying to make something that if you are trying to repair a bone, you are developing a material that looks like bone. But if you really look into the nature, and this is an example, I will definitely not go into details of this, but this really shows only how extremely complex a bone is as a material, not only from the perspective of the material science, because it is a combination of a polymer with a ceramic, but also if you think about the structure, so how all these parts are intertwined, how they are built. It is really very, very fascinating to see how nature has succeeded in creating such an extremely complex tissue and organ, and which is not so strange, because bones that they carry our entire body. So it is really very intriguing how the nature has made such a tissue. But if you are trying to mimic this, if you are really trying to take it in a laboratory or to take it in a factory and try to build it itself, it is almost impossible. And the question is actually whether you need to be so complex, whether you really need to make bone in order to regenerate or to trigger the body to repair itself. So something that I have been working on in my own research is actually to see, can we go much simpler? So can we think about a single part of this very complex tissue? That is very simple, that is inexpensive, that you can make in large quantities, and that we can use to implant into the body to trigger it to repair itself. So instead of making a completely new bone outside the body and transplanting it, thinking of something that is more simple, but that it will give, like in that nude that I showed in the very beginning of the presentation, that will give the right signals to the body. I need to make a new bone here because there is a defect. So what can I offer to the body to seduce it, to give it the right signals to regenerate itself? And what we have been focusing on is the ceramics. So now I'm coming back to our cup of coffee, because the material that I have been working for almost 20 years on is actually quite similar to the material made or used to make such a cup. So it's basically a ceramic. It is a powder that you mix with some kind of a binder. You bake it at a very high temperature and you are left with a ceramic. And that is actually, so it's similar, the process is very similar, it's very simple, and this is also just to show that we can make it in very large quantities, and that is really important for all those patients that in the future will have, that will need bone to be regenerated. But of course, the chemistry of the material of the ceramic that we use for bone regeneration is slightly different from that used to make such a cup. It is actually very similar to the ceramic that we also find in natural bone. But to keep it, to show you how simple it actually is, these are the small particles that you see on the right-hand side. These are actually very small particles, a few millimeters in diameter, that we made, that we produced, that actually do exactly what we want them to do. So we can put them into a defect area after tumor removal, and they will give the right signals to the surrounding bone, to the cells in the body, to start regenerating. And that is also not unimportant, after a while, these particles will disappear. They will dissolve. So they will be temporary in the body. They will trigger the bone to complete this healing process, the process of regeneration, and they will disappear. So eventually, if you are successful with such a regenerative therapy, you are left with a natural bone that is built inside the body by actually only implanting something that is relatively simple and it really can be made in kilograms for relatively little amount of money and capacity. So I will now show you a few more, let's say, scientific slides, really coming from the scientific publications, but I will guide you through these because together with a team of about 20 people, we have been working on understanding these materials, on developing them, on tweaking them, on giving them the right properties. And so these are a few slides, so I will not go too much into that, but what we have been working on is, on the one hand, we tried to modify the chemistry, and that is really very almost a trial and error approach. So we know what the body contains, what the normal bone contains, but it is difficult to mimic that. You can play with the chemistry, you can play with one compound and the other compound. You can also, and that is also something that we have seen, you can also play with the structure. So you can also, depending on at which temperature you bake such particles, they become more or less porous. And that also has been shown to really provide or exert a very different response of the body. So we've been working on this with a whole team of people for about 10 years, pretty much trial and error, trying it again. And in the end, we were able to actually improve those materials more and more. And what you see now here, and these are a few things that I will show you. In those images that you see in the middle, those are what you see in black are actually the particles that we developed, those little materials. What you see in pink, in bright pink, this is a newly formed bone. And the only thing you should realize is that you see that from left to right, you see more and more red. So actually, only by modifying the properties, the structure and the chemistry of these particles, we were able to make them inducing, so triggering more and more bone formation inside the body. So actually, we were able to tweak them to give more and more potential to the body to regenerate itself. Now, what was probably the most important, and this is still quite an old result, but this is probably one of the most important results that we've shown, is that at a certain point, the material, the particles that we developed, we tested them in animals, in a large bone defect, and we compared them to autologous bone. Autologous bone is that bone that you remove from a hip and move it to a defect area, right? That is what the surgeons consider the best option at this moment. And what we observed is that actually the materials that we developed are equally potent in regenerating this large bone defect as the patient's own bone is. So this is an animal model, it's not in humans, but basically we know that in a similar mechanism it would work in humans as well. Now, why is this important? It is important on the one hand because you don't need to remove a bone from elsewhere, and we can produce these materials in large quantities, and they are off-the-shelf available. So if a surgeon comes in after a motorcycle accident, you can basically take it and use it automatically. So it's a relatively inexpensive therapy, and it does what a normal bone does too. So it basically tells the surrounding of the body, this what is here, we have to create a new bone, and those particles will then disappear. So you will basically be left with a newly formed bone without even noticing where the defect eventually was. Now, you can imagine, and that is also how we have seen it, this was an enormous success. And based on these ceramics, we have brought them, the spin-off company was formed, actually a few of them. The products based on this invention, on this development, are actually in a clinic. Over 300,000 people worldwide are being used based on this development in different clinical settings. So on the one hand, I think you can really consider it successful. We've done, so after those animal studies, we've gone into clinical trials, we developed products, produced it in a clinic, and also all these companies are further developing these materials as well. So on the one hand, you could say it's a great achievement, but of course we as scientists, for us it was also probably the largest frustration despite this success. And why? Because we actually never completely understood what is it that makes these materials so special. So I mentioned to you the entire process was a kind of trial and error. So we did not know, we still could not develop a recipe. How do you make a perfectly working material to regenerate large pieces of bone? Because we were basically trying it, and we were maybe lucky, maybe successful, but we still could not completely define what makes those materials, what is responsible for these very special properties. So we did not understand the mechanism, and because of that, it was also very difficult to further improve it. And of course, what is very, very important, I remind you of the cup of coffee, those materials have actually the same properties. So you know what will happen if you take a cup of coffee and you drop it, it will shatter, it will break immediately. And actually those little particles, they are small, they are even porous, and you can even crumble them between your fingers, which is a kind of counterintuitive if you know that you actually want to use them in a bone and you want to walk immediately, right? Because this regeneration does not happen within hours, you need a few weeks. So that means that you actually still have to work with plates and screws to temporarily actually stabilize the bone until the process of regeneration is done. And that is what you don't want, because you want a regenerative therapy. So something that we are working on now is to try to understand and investigate how can we improve the mechanical properties so that actually you have a material that will regenerate, but that will also provide the mechanical support. So once you implant it, the patient can walk, start walking immediately, and can actually wait until the process of regeneration is completed. Now, I can tell you that is not easy, because what we are doing there is basically going back and trying to mimic what nature has made regarding bone. And I can tell you that that is really not an easy endeavor. But again, I think there are a lot of improvements, and you can consider this a great success. And there is also really, as always in science, there is a lot more to explore. So I will not go into details of that work now, but I will show you another example to give you another flavor of also another application of regenerative medicine. And now I hope that, so can we turn off yes, so I will just talk you through it. Perfect. So here we see a heart, and what you see there is a heart valve, and colleagues of mine at a different university with whom I closely collaborate, they have developed also a material like the small particles that I showed you before used for bone regeneration. They developed a heart valve that will actually replace the malfunctioning heart valve, because if a heart valve does not function properly, it will not close and open properly, and the blood will not stream, so the pumping of the heart will not be fine. So what you see here, they have actually developed, and I will show you a few more details, they will develop a material in the shape of a heart valve, and when they implant that, what you see is that, again, this material gives the surrounding tissue the trigger. I need to create a new tissue of the heart valve, and the material that you implanted again will disappear. So it is exactly the same process as with these particles, but now in quite a complex organ. And these specific heart valves were actually developed for children, so pediatric patients with congenital disorders, so when the baby is born, and some babies when they are born, they really have a malfunctioning heart valve. So in those kids, the heart valves do not open and close, so they really have a very difficult start. And what we were doing in the past is to use metallic heart valves that exist for a very long time. But you can imagine that such a child, when it grows, the metal will not grow together with the size of the child. So those children really had to undergo many, many surgeries until they reach the age of grown-ups. And every surgery is extremely problematic and risky. So by doing this, we are now trying to actually implant something when a baby is born that will be replaced by a natural tissue, and that natural tissue will then grow together with the child. So if you do this correctly, you would only need one surgery, which of course would make a tremendous difference to a child and to their parents. And also here, again, a similar process as I showed you before for developing, for going through this process and developing it. What you do is you really try to study how does the heart valve in a humans look like? What kind of material it is? What kind of properties does it have? And then you start designing. You start, in this case, this is a polymer, so you start really kind of a plastic. You start thinking about properties, you start synthesizing such a material. Then you have a lot of also manufacturing techniques to make it a structure, to give it a structure that is similar to what you would see in a real heart valve. We are working with 3D printing, we are working with electrospinning. There are all kinds of techniques to again provide it with the right structure, and that really goes from a very fundamental chemistry to manufacturing techniques, to understanding how it would really, to investigating how such a material would interact with the body, with cells in the body, and eventually really trying to understand how it works with patients. So it is a very, very long process in developing. Such developments really easily take for 20 years, even, and then you only start to go to the regulatory affairs and really trying to get an approval to use it in real patients. But the idea is exactly the same, trying to develop something that is as cheap, as inexpensive as possible, and yet potent enough to trigger the body, to give it a signal. You need to create a new tissue. You need to repair this defect in order to become functional again. So now let me take a last few slides just to go a bit more into details how I experience this field. Because this is really the colors of these what you see here is really how I see the field of regenerative medicine. I just mentioned to you the institute where this work was done, my work was done, is really an extremely transdisciplinary institute. My own background is chemical engineering. I'm actually a materials scientist. And when I started working, I was working on completely something else that had nothing to do with any implants in the body. Then when I started doing my PhD, I started really developing materials for humans. But in this institute, I work together with engineers, I work with biologists, I work with clinicians, but also with mathematicians, people who develop models. So it's extremely, extremely transdisciplinary work. And this kind of challenging applications also require such a transdisciplinary work. That may sound very simple and very logical, but I can tell you that nothing is as difficult as have all these disciplines understand each other, really finding a common language to understand what am I talking about, but also respecting each other's disciplines. And that is something that I really seen quite often. To give you an example, I was working very closely with somebody who was a cellular biologist. And I came in and I said, well, I'm a materials scientist, I'm developing all these materials. And he would tell me, well, why are you working on that? You can still order it. They get a catalog and just order that you can buy materials, right? So and this really shows you how difficult it is to find a common language and work on this together, but how extremely important it is as well. Now, what I would also like to mention is, and I'm taking an example of something that is completely irrelated, but that is the development of a computer. So here you see the typing machine in the 60s, and then you see the inside of a computer, and now you also see the supercomputers on the right-hand side. So if you look at this development, it has, I mean, unimaginable how quickly this technology develops, and if you think about computers. If we now think about artificial intelligence, for example, 3 years ago, nobody would have heard of ChatGPT probably, and now who in this room has never used one? So such type of technology goes extremely, extremely fast. That is quite different in the field that I'm working in, which is kind of intriguing because why, for us humans, I think having a human body that is very functional is much more important than having a very fast computer. And yet, the developments and the technology in the field of, for example, regenerative medicine or even the implants for the body, that does not go very fast. And even the hip implant that I showed you in the beginning was developed in the 80s. And if you look into it now, it's pretty much the same. Hardly anything has changed. Now, you may wonder why that is. And that really has to do with the fact that we as humans are not, I find it difficult sometimes to accept something in our body that is strange, right? So that is also one of the reasons why when we are developing this kind of regenerative therapies, we try to make something that looks like bone in order to implant it into a bone, whereas I can imagine implanting a microchip would be much, much more functional. But there is not even a single doctor in the world who is even thinking of trying to implant such a microchip in a human. So there are, of course, many ethical issues, but it is really important to realize that the acceptance of such a development is also really going very slowly because people want to be 100% sure that it is safe, whatever you are using. And that really goes slowly, and it takes a lot of time. That is also why this field sometimes moves quite at a completely different pace as a lot of other technology. And another thing is, of course, an ethical issue. And an ethical issue, if we think about this, like, would we like to become like those newts? Would any of us want to cut one leg off and say, hey, let's wait for a couple of weeks and then the whole leg will grow? Maybe, but you can also think that while this is very medical and this is very much in improving the quality of life, you can also think of other reasons to use this technology. Can we make a different type of a leg? Can we make a longer one that's like make us taller? So as long as it's medical to really keep us functional, it may be an easy discussion. If you start at using it to extend the lifespan, to change us as humans, then everybody is like, well, I have to think twice. So also that makes my own field extremely intriguing, because you are not only there, even no matter how successful you are with developing a technology and developing a therapy, then the entire process of acceptance by surgeons, by patients, only then starts, and all the ethical issues around it as well. So with that, I don't want to be like the politicians taking too much time, but I still have 5 minutes, so I will use those. Not before I acknowledge, because none of this work has been done, well, some of it has been done by myself, but the largest majority of it has been done by many, many students and postdocs and PhD candidates that I supervised, and I'm greatly, greatly thankful to all of them. Let me just use a last few slides to say something about myself and maybe my own academic career. This is where I was born. Some of you will recognize it. This is Srebrenica. I was born there in 1977, and I stayed there until 1992, when the war started and I left. And it was a life, I think, as of any other 15-year-old. And it suddenly changed, like many of you and many of your parents would have experienced, almost overnight. And very soon I left. I left to the Netherlands after a few months, and I was 15. I ended up as a teenager in a country that I did not speak the language. I was in a refugee center, and my father was still here in Bosnia. So for me it was really a lot of expected to start a new life, while actually my thoughts were somewhere completely different. And this has not been an easy path. So where I am now, this is a different picture. This is actually my new city where I work. This is Maastricht University. And this is, it looks like a carnival, but it's actually an anniversary celebration of the university that we do every year. And every year we walk from the building, our main building of the university, to a place where we celebrate our anniversary, and all the professors that you see, they actually walk through the city. So this is a kind of a procession that we hold every year. So this is where I work now as a rector, as one of the members of the executive board. And in this entire, and between that, as I said, I finished my high school. I went to study at the university. I did my PhD, I did my postdocs. I worked as a professor, supervising candidates, giving also education, and then finally I do the job that I do now. And there are a few things. I mean, I could probably talk for ages about all kinds of things about that process and how that went and how I felt. But I thought of sharing with you a few tips, and that you may or may not want to do anything with, but I thought they would be important because they really are how I experienced it. One of those is that you should accept the things sometimes simply the way they go and try to make the best out of it. And let me give you an example. When I finished high school, I really wanted to study anthropology or journalism. But as I said, I came in the Netherlands, I was there for 3 years, I hardly spoke any Dutch, and I thought, what kind of journalist I'm going to be if I cannot even write a proper text? So that's why I decided to study chemistry, because with formulas and numbers, that's much easier, right? There is less text to be done. And back then I was dissatisfied, but in the end I think I made the best out of it, and it made me actually enter this very fascinating field of regenerative medicine eventually. A second maybe is also allow yourself to get surprised, because there are not so many things you can plan, and I know that we Bosnians, we know that you can plan all you want, but sometimes just life happens and some very bad things can happen. But it is okay. Sometimes it is just fine to allow yourself to get surprised. And I think scientific research, is the best possible way to get surprised. Let me give you a very brief example. I was doing one of my traineeships in Asia, in the Philippines, and for months and months I had to do some experiment and it wouldn't work until there was a blackout, so the electricity was cut for 3 days. And I thought, well, you know, the whole experiment can be thrown out. But then I came back after 3 days, and actually the results were excellent. And one thing that I did not think of is that the temperature could address or affect the process that I was working on. And because of the blackout, temperature went to 40 degrees, and suddenly my experiment really succeeded. So also that is what the beauty of science is, that sometimes it is really good to organize and do good experiments, but also to get surprised. Now the third is, I put it in there because I really think that is something I always did, is work very hard. And I said it in the beginning of my own talk, is that Bosnians know how to work very hard and to persist and to do things once and again until they succeed. And that is, I think, important. That is also what personally helped me the most in my academic career. And last but not least, it really doesn't matter who you are. It's okay to be humble, and I think that your titles don't really matter. Whatever you have achieved cannot be, is the only way to show that is by your own contributions and the impact that you make. And no matter how people look at you, I always believe in the real results and the real evidence that you can provide. So I think if you stick to that and if you focus on the results, everything else will come there. So with that, I would like to thank you. I hope that the organizers that I gave the talk that you expected from me. And I very much look forward to meeting many of you during the networking event after that and answer any questions that you may have. So thank you again. Congratulations to the foundation. You're doing a great job, and I wish you a great conference.